Thank you.
We will we'll go ahead and start. Okay. Amy, you want to kick us off?
You bet. Hello and welcome to the Healthy Diet Prescription Program Phase 2 launch webinar. We're glad you could join us. I'm Amy Swanson. I'm with Kansas Statewide Farm Worker Health Program, and I'm joined by Tina Payne and Julianne Walker of Wichita State University Community Engagement Institute. Together, we'll describe an opportunity for healthy diet resources for farm worker families you serve in your community. We'll walk you through the program, funding available, required elements, and the application process. At the end, we'll save some time for questions, so feel free to save those or drop them in the chat, whichever works best for you. We are also recording this webinar for providers to watch at their convenience, or if you'd like to rewatch it. Healthy diet prescription programs are growing in popularity in the United States. They are a strategy healthcare providers can use to support patients to increase the intake of healthy foods and decrease the intake of less healthy options. These programs work to reduce barriers such as accessibility and affordability to healthy food options. In the long term, they complement other medical strategies to improve a patient's overall health. There are many successful diet prescription programs in the United States. Here are some details from one in Idaho that was created for patients with diabetes and chronic conditions to be served at the community health centers. And as you can see, after 12 weeks, the patients were able to reduce both A1C and BMI levels. Further, the program had a positive economic impact on the community. We wanted to try something similar in Kansas, so we sought resources from the Health Services and Resources Administration to develop and implement a healthy prescription diet program for farm worker patients in Kansas. As a part of this work, KSFHP will provide access points with startup resources as well as funding for food expenses ongoing. We believe that the program will help Kansas farm worker families to bridge the nutritional gap often created through lack of access and affordability of healthy food options, as well as offer culturally preferred options to our clients. Farm workers and their families will also receive individual education, helping them to achieve individual health goals in partnership with their medical care providers. While this program is still very new and we want to expand it across the state, we are encouraged to hear stories of success from our two initial pilot sites. One fond memory is from Haskell County and the first young child that they served and how excited he became when he received a piece of fruit at the end of his visit to the local health department. Now I will pass the presentation to our partners at Wichita State University Community Engagement Institute to describe the program components, existing pilot sites, and the application process. I hope this program is a good fit for your community and that you'll consider applying. Tina?
Thank you, Amy. We really appreciate everyone being here today. And we want to say a special thanks to the Kansas State Farm Worker Health Program for allowing Wichita State University and the Community Engagement Institute to work with you in this exciting program opportunity. Julianne and I are going to walk you through the essential program components, the 2021 pilot sites, and the application process. We welcome your questions through chat, or if you would like to, you can hold them for at the end and we'll be happy to answer them then. When WSU CEI began work on this program, team members knew the need and desire for a program was there, but they also recognized that there were barriers that existed. And some of those were especially felt for migrant and farm worker population. This slide shows a sample of barriers that are sometimes felt by the entire community, such as closure of local grocery stores, the cost of fruits and vegetables, and others are especially real for farm workers who work really long hours. They may travel from home countries with familiar foods that are not found in Kansas, and also are living in environments which may not have the tools to prepare healthy foods. We went into this program design with those barriers in mind and work with local programs to find ways for the programs to identify, reduce, and eliminate barriers for the patients that they serve. After extensive research, the program design team found that the Kansas communities needed the ability to customize the approach. I mean, every community is different. And so regardless of how the farm worker receives the food, there are essential pieces, though, that must be in place. And they're depicted here, and I'm going to go into greater detail describing each on the following slides. As you think through these components, think about the ways your community could put these pieces together for the people that you serve. First, we have eligible recipients with eligible diagnoses. So all participants in this program must be active participants with the Kansas State Farm Worker Health Program. We recognize that you may have others in your community that could benefit from such a program, but this program is exclusive for farm worker patients. Patients should also be diagnosed with diabetes, pre-diabetes, hypertension, obesity, overweight, and or food insecure. Now, what we found, though, that this is a pretty broad stroke of diagnoses, and we believe that it would be fairly encompassing of your patient population. Family members are eligible and encouraged to participate in the education portion of the program as well. Second, access points should have a prescribing provider who's willing to participate and write a prescription for the program. Prescriptions must be written annually and submitted to the farm worker program for continued eligibility. Providers can be staff at the access point or working in formal partnership from a practice in the community. Access points should work to not only gain the initial agreement to participate, but to retain the buy-in from the providers to initiate the prescription process each year. As Amy said earlier, this is really seen as part of a package of what the provider can offer for the patient, and so we want to see them as actively engaged as well. Eligible foods for this program are fruits, vegetables, and beans, and they can be a mixture of fresh, frozen, and healthy canned varieties. When it comes to Kansas communities, there is a wide variety of food sources. Access points participating in this program can design this portion in the best way which works for their community. So examples include establishing an internal food pantry, partnering with a local food pantry, or making arrangements with local vendors such as farmers markets and grocery stores. When partnering with a food pantry, farmers market, or grocery stores, patients will receive a food coupon to purchase the food. And so then the access point would create an invoicing system where the vendor collects the coupons and then is reimbursed by the access point. Local grocers, including ethnic markets, can be more open to this type of arrangement since they may have greater flexibility to be reimbursed this way. The startup funding that you may have seen listed in that 3-page document, the startup funding that follows the expenses to establish this program. So an internal food pantry will require equipment such as like a freezer or refrigerator or shelves or other things. And so when creating an internal food pantry, programs should build in the steps of purchasing food, monitoring inventory, and maintaining food safety. Partnerships with local vendors may request salary expenses for establishing those sites. When working with outside partners, programs should establish those partnerships through a formal MOU and build in a reimbursement system for paying for the cost of the food. Important to note here, and we're going to talk a little bit more in the application portion, but it's important to note here that, it also can be a combination of equipment and salaries and other things, whatever meets the needs of setting up the program in your community. There just is no one right or wrong way. There's only the best way for your patients and for your staff of your access point. We know education is key for many participants to develop healthy shopping techniques and meal preparation. Education may be provided by internal staff or in partnership with others. Educators could be, just examples, community health workers, a dietitian or nutritionist, a medical provider, a health educator, or others. Examples of the education could be nutrition information, recipe help, providing a cooking class, going on a grocery store tour, and also assisting the farm worker clients with navigation of the American food system, helping them find those foods that they really like. Funding requests can include expenses related to education, such as equipment to construct a cooking class. And even the picture on this slide is of a shopping bag distributed to participants in Riley County, which is a program that's hosted by Konza Prairie Community Health Center. The cultural respect and responsibility is key for this program's success. There is no one-size-fits-all approach. Talk to people about what they want to eat and the recipes they want to prepare. Access points should figure out how to make this work on an individual level. In addition to using bilingual services for written and spoken activities, you can ask, well, like, which cultures are represented in our eligible farm worker patients? Which foods are we able to access locally that are familiar in their cultures? How can we provide education in a culturally and linguistically accessible way? Some communities may have ethnic markets willing to partner in providing great options embraced by your patients. Programs should actively consider the life of a farm worker. So remarking back to the barriers that we noted at the beginning of this section, patients identified long working days. And they talked about the lack of transportation and living in neighboring communities to where they seek care. When you're developing a system, the farm worker's life should be in consideration. So an example of this can be if you decide to open an internal food pantry, well, then you're probably going to need to maintain open hours late in the day or on the weekend for access. Another example is finding vendors in communities closer to the homes of farm workers and reducing the transportation time. Providing cultural education for vendors to improve the comfort level of the farm worker shopping there is very important. This is a part of that continually making the program better portion of the work, and it needs to emerge over time. It's certainly not something that we would anticipate you would have done immediately. A thread connecting all 5 of those components is your staff. Staff are needed. They are needed to shop, to educate, to complete reports, and to recruit participants. Volunteers can be engaged with some of the staff portions of this work as well. They can assist with duties such as shopping, stocking, and distribution. Staff are also needed to make connections within the clinic and the community. We enjoy our conversations with the pilot sites where we hear stories about staff actively working to identify eligible patients and to find ways to engage with them. The startup period is especially important when your staff are building trust with the patients, because then eventually the patients become an unofficial member of your staff, providing referrals to others. We know, just like you know, word of mouth is the best way to recruit participants. So, speaking of people, I am now going to pass this on to my team member, Julianne Walker, and she's going to give you examples of the existing pilot sites and the application process for 2022. Here you go, Julianne.
Very good. Thank you, Tina. Welcome, everyone, and good afternoon. As Amy mentioned before, that this program received initial funding through the Health Resources and Services Administration in 2021. It's important to note that this program works in partnership with other services provided by your access point. And the Kansas statewide farm worker health program considers the Healthy Diet prescription program similar to other medical prescriptions written for your patients currently. While funding for this program is appropriated on an annual basis, increased program and patient participation will emphasize the importance of ongoing funding. So we will be in touch to provide some technical assistance and some evaluation pieces that will help us gain a better understanding of what that ongoing funding might look like. We're thankful to 2 pilot sites that we're going to highlight a little bit for you here next, that started their programs in early 2021 and have continued into this year, and those are in Riley County and also Haskell County. So first of all, Riley County received funding through Konza Prairie Community Health Center for patients that are seen at their satellite site through the location of the Riley County Health Department. Their system that they have put in place is working with a food coupon system. So Tracy Sabo, who is the registered dietitian at Konza Prairie, developed that system where patients can come in and receive those coupons on a regular basis, and they can take those to 4 different local either farmers markets or farm stores that are located in Riley County. So it's a benefit to them, and also looking at when those stores are open. Tina mentioned this earlier, is that one of the things that they talked to the vendors about was making sure that there would be access year round. And so a couple of those farm stores do have that year-round access. So along with the coupons and the prescription piece of the program, Tracy is very dedicated to be able to provide that nutrition education. So when patients come in, she and their clinic champion, who can provide interpretation services, meet with patients and go through those nutritional handouts and the bags that you saw that have the different sides that have all of that education and information on it. They can sit down and really talk one-on-one with patients and clients to make sure that they understand the program and that they can really access good information on how to make healthy decisions around food, how to maybe prepare those fruits and vegetables that they're receiving when they go to the farmers markets or those farm stores. They requested most of their funding to be for salary expenses, and this is partly because they did work with that vendor system. So a lot of their staff time was really looking at putting memorandums of understanding in place, doing a lot of visits to those different vendors and sites, and having conversations about how those partnerships could work. And so that's kind of one way that you could look at a program if you're going to use the kind of the outside vendor portion of that. One of the things that they have realized, though, is that they're noticing that there's difficulty with, as Tina mentioned, transportation and being able to access foods in an area that's closer to where they live. And so Tracy is now also working with outside counties and communities to really be able to kind of create that collaboration and that partnership to be able to increase access and to maybe locate some additional vendors that might be closer to where those farm workers are currently living. At present time, they have provided 2 patients with the actual prescription, and they're able to now utilize those coupons at those vendors, and they're working very closely with their case managers to identify other patients that are within that clinic system who do qualify based on diagnosis and eligibility, who then they can make sure that they get referred into the program. So we see great things for this program, and they started off with a bang, and I think they're going to end that same way with helping multiple people in their county and their communities. So the second site to highlight from this pilot program is the Haskell County Health Department. So they decided to take a different route. They decided to do an in-house pantry, and for where they're currently located, that made most sense to them based on accessibility and feasibility of the program. So a lot of their funding was their startup funding was aimed at buying freezers and putting in shelving units and making sure that they had internal policies and procedures for safe food handling and things like that in place. And so that's kind of how they geared their program and have utilized that startup funding. In addition, they did use some for salary and benefit expenses to be able to pay for some of the work that Robin Hull and CC Chacon are using for their staff time for this program. They also have kind of a unique piece to their program. They have sought out donations from other community members for things like meat and other products that can be paired with those healthy food options. So when somebody comes into the food pantry to shop through the farm worker program, they can access frozen and healthy canned items and dried beans fresh produce when it's available, but then they can also opt to get some meat or some other items to be able to pair with those items. And so they've done a really great job in their community to collaborate to make sure that this is more of a well-rounded program, and that they're able to offer a lot of different opportunities for patients when they come in. To this date, they have filled 5 prescriptions in March and 7 in April, and they're going strong in May. And so with the work of Robin and Cece and their case managers there, one who's on site who speaks Low German, who can really make connections into some of their patient population. They've really transitioned this program very quickly, and we anticipate that they're going to continue to move ahead and have a successful program with this as well. So we're really happy that we have a couple of pilot sites to be able to show all of you and to be able to highlight for you as maybe you choose to kind of jump into this work and have something to look to in order to get your program started. So our grant team has really enjoyed working with both of the pilot sites. It's been a joy to meet all of their staff and just to really see that connection with the work, and also the care that they're taking to make sure that patients, especially patients who maybe haven't been identified yet, but maybe a case manager knows ahead of time that they would qualify for the program, that they're all coming together and really communicating about what's best for farm workers in their area and utilizing this program to the best of their ability. And Tina and I and Nicole and several others from the Wichita State University CEI team, we've been able to be a part of that process. And so looking forward to new sites, we can look at it as like pilot sites or adventures. They're often creating paths for others to follow. So we've gathered lots of information. We've kind of picked their brains as they move through their programs and setting up their sites to really gather information that can be useful to others as they start this journey. Throughout it all, though, the bottom line is that we truly have come to know through stories that we've heard, through comments that have been made, through just listening to conversations between the program directors and the case managers, is that families are being served by this program. And they're being served in a way that maybe is unique to that area. And so that's truly what this program is and what it's meant for. And so that's why we're excited to be able to roll this out as a round 2 and to be able to include others into this program for other optional sites and access points across the state. Robin Hull with Haskell County actually helped us kind of realize that we were on the right track when she shared an email very early on with us from a patient that she had come in. It was one of the very first patients that came in, and her quote was, "We filled our first prescription. The patient was so thankful because she has 2 little boys and her husband has not been able to work for 2 months. We also have another family coming in later today that should meet the criteria as well. Let's rock and roll." And she put a big emoji smiley face on the email as well. And so that just really kind of solidified the program in and of itself, is that it's meeting the needs of the people who need those services. So moving into the funding piece, if this program feels like it's a good fit for you, for your access point, then the following information, please take notes, take note of the slides. This is where you can gain more access on how to participate in the program as an access point. So the funding is available based on the number of qualified patients residing in your county. So we do have an active list that we can, if you have questions, we can get you that information if your access point is eligible for the program at this time. And you can also look at the Healthy Diet Prescription Round 2 information that Tina sent out previous to this webinar. So based on that number of those residing in the county, counties are then put into different level categories on how much funding they can receive. And so you can kind of see that here on the slide. There is only one startup fund award available per county on the list. And we do encourage collaborative grants. So if 2 access points want to get together and work in tandem with one another, more power to you. I think whatever makes this program work in your area or areas, we're willing to entertain that. So please know that there is some flexibility with this, and we are always open to questions and really kind of being maybe a part of that thought process when you're thinking about how your access point or your other area access points could coordinate some efforts. The startup funds do need to be expended by March 31st of 2023. And so if you're selected as a program, you can anticipate to go through the award process and receive funding within 30 days if your project or program is selected. We'll have opportunities for you to give regular updates and also submit quarterly evaluation reports so that we can kind of make sure that things are on track and on task and be able to plug in technical assistance where needed. Sites will also be asked to consider participating in other activities to promote programs, such as maybe providing a presentation or getting in conversations with other interested sites on how maybe your program is going or how you see moving forward with the startup funding. So startup expenses, as Tina mentioned earlier, kind of largely fit into these 3 categories that you see here on the slide. So supplies, equipment, and salaries and benefits. Really wanting it to match the format that you would like your program to take. So in other words, if you're looking at doing an in-house pantry, more of your expenses may actually go to supplies and equipment because you need a freezer or you need access to electricity in the room where that freezer is going to be, or you're needing shelving to be able to store those canned goods. And then you might have some salary expenses on top of that. If you're looking at more of the food vendor portion of that, most of that will probably be salary and benefit expenses based on who's going to be reaching out to the vendors, how long is it going to take to get an MOU signed with those vendors, etc. So really use that budget form and the narrative through the application process to paint the picture for the reviewers so they can kind of get a general understanding of how you're wanting to use that startup funding and what categories you're needing that funding to mostly be represented in. If you're needing assistance, please reach out to the Wichita State grant team, and we're happy to jump on a phone call with you and or chat via email to make sure that we have all your questions answered. So one of the things we do want to point out as well is we've talked a little bit about startup funding, but not included in those startup expenses are monthly food costs. So as you can see here on the slide, food costs per farm worker are decided based on household size. The funding is limited to the household. So if both of the household leaders actually are qualifying patients or have a qualifying diagnosis for a food prescription, the amount of the funding would stay the same. So essentially it's one per household, even if both qualify for a food prescription. Funding for the food provided then is reimbursed through the Kansas Statewide Farm Workers Health Program that will go directly to the access point via a monthly request system that Tina kind of talked about, with making sure that you have a accounts payable system that's up and running so that you can kind of track those monthly expenses for those food expenses. The funding is ongoing, meaning active program sites will receive food funding as long as the program is supported by HRSA. In addition to the startup funds, active sites also, as I mentioned before, can receive technical assistance through WSU, through our Center Community Engagement Institute folks. So that would be Tina, myself, and Nicole Friend, who helps us with evaluation and reporting for that team. We typically set up monthly meetings with each site so that we can just check in, make sure folks feel like they're on track, answer any questions, help make connections, if they're needing assistance with generating an MOU, things like that, we can provide that kind of technical assistance. And then we're also available upon request. If those monthly meetings don't end up being enough time, we can certainly spend more time with that technical assistance. So as of right now, our full team through Wichita State University's Community Engagement Institute team for this project includes Aaron Davis and Jessica Smith. They are both providing administrative support to the program. And then Nicole Friend, who I mentioned, for reporting and evaluation, and then Tina and myself for program support. So if you are considering applying, feel free to reach out to any of these team members. Their information is here on the slides for you, and that was provided in the webinar email as well. So applications for program funding will be entertained until that annual funding amount is expended. So it's kind of on a, if you want to say, a first come, first served basis. So if you have interest, please reach out and let us help you get that application in as soon as possible. Please do look at the Healthy Diet Prescription Round 2 document for the application link and details, and make sure to let us know if you do have any questions moving forward. All right, so that's kind of it in a nutshell. Questions that you all may have, we'd love to hear from you. We'll open it up to, you can pop them in the chat, or you can take yourself off mute and feel free to ask your questions. Don't be shy.
I was going to go back through and look at the chat box. We welcome Lynette. Lynette and I have lots of stories to tell from my past life in Harvey County. I'm excited to see you, Lynette. Lynette was asking about a document to the email. I can send that out again. I'd love to say I was talented enough to include a link here in the chat, but I'm probably not. So, but I'll send an email out afterwards to everybody who's attending with that document, and you can take a look at that. The document is essentially just what we covered in the webinar, just what are some of the program elements and the funding and other things. And so should pretty well cover it. It also, the third page of that document has the questions that are asked in the online application process. So you'd have that list of questions that you can find the answers to before you start entering them in through the link.
So I just had a question. This is Julie Gibbs from Riley County. I know that Konza is one of the pilot sites. Would that make us ineligible to apply?
Yeah, which hurts my heart to say that, because, we want to work with as many people as we can. I saw when you registered, I saw that you were with Riley County, and I was like, well, maybe she's working with other counties or others. Unfortunately, the funding is per county, and so Riley County is covered. But what we know is that there are quite a few farm worker patients that are living in neighboring counties around you, especially Washington County. So one thing I would recommend is I know Tracy is starting to reach out to Washington County to see if they would like to develop a program there. And so if you and Tracy could band together and work together, we've seen the numbers from Washington County. We know there are a lot of farm worker patients living in Washington County. And I think that they're traveling either to Riley County or Geary County for their primary care, because we have those numbers from Konza. We also understand that they are traveling as well more towards Kansas City for primary care, but that doesn't necessarily mean that they need to travel for food. And so what we'd love to see is some type of a collaboration. And so that's something that, while the money would go to Washington County, it doesn't mean that it couldn't be that you and Tracy couldn't use your collective expertise to help them set something up. And we would love to see that, because there's a lot of people there, and I bet they would appreciate being served.
Okay, that's great. I'll get with Tracy then.
I appreciate it. Thank you.
Thank you.
Yeah, Tracy's a good one. I bet you know that. And so, so she,
I do.
so she was on board with us a year ago, and we're starting to watch that trending of the numbers. I know one question that I had received via email was how are those numbers calculated? Well, they are figured on the number of patients that are residing in the county. So it's based on the patient's residence, not on how many patients the access point sees. So, that was a really clear decision that the farm workers program made along the way, that they said, we need to do it based on where they live. And so that's how those numbers came out.
Thank you.
You're welcome.
So, hey, Lynette here. Question about sustainability. Has there been any conversations about that, seeing that this only goes through 3/31/23?
The startup funds go through 3/31/23. The funding for food, as long as HRSA believes that this is a good project, we believe will be ongoing. And so how do we get there? Well, you and I both know, Lynette, that's through numbers. So that's how we, oh shoot, I think my internet is jumpy. I'm sorry, you guys. Can you still hear me?
Mm-hmm.
Okay. So we have to get the numbers in order to continue to get HRSA to continue to support it. But as far as we know, and this is where we would listen to Amy, as far as we know, we are solid for at least the foreseeable future, and hopefully will be more so. The more progress we make, then we would hope that then the more secure the funding will be into the future. But that covers the funding that's into the future, covers the $40 or $45 a month for the food. So even if you would decide, Lynette, to do an in-house food pantry, you're not going to use any of those startup funds to buy food. You're only going to use the startup funds to buy equipment or for the staff time.
Yes, and all that's correct. And we would continue in our progress reports to HRSA to update them on progress for the program. And I think as long as we're demonstrating progress, we'll be able to maintain that. And of course, we're looking at that budget-wise too. Even in phase 2, we looked at that a little bit differently as compared to phase 1.
We understand that not every access point is going to be able to track those A1Cs and some of those BMI levels. I mean, we'd love to be able to see that. But we're starting with the intuitive portion, which is getting people food. That's what we're starting with. And then what we can do with it into the future will be up to, largely up to the access points. Those are great questions. Should we can hang out with you?
My question is more of like, they talk about applying online. I'm not seeing where to apply online.
There should be a link in that 3-page document. There should be a link in there. Let me stop share. And so you don't see a link for that. Let me pull it up. My wishes for your patience, please. And if Julianne can get to this faster than me, that works too. We can pull it up. There should be a link in there. We have an online application through our program, which is monday.com. We have an online application process that Daniel has created. Let me go back to sharing here. So this is the document that went out with the original email. This is the document, and there should be in here, there's the webinar. There should be at the beginning of that page 3, this. So if you click this link, so Monica, do you have this document? Were you asking? I don't know who was asking. Anyway, if you have this document, you should be able to click this link and it takes you to the online. But again, I'll send this out to all of you afterwards so that you have it. And then again, these are the questions Don't be scared off by the number of questions. This looks lengthy, but that's because there are questions for each type of site. So you would want to look through, and so if you are going to do an on-site food pantry, you're only going to answer these questions. You can certainly do a hybrid, and that's something that Kansa Prairie was looking at a certain point, doing an on-site food pantry as well as doing partnerships with local food vendors. And so, you know, you certainly can do a hybrid of these different models. So you see here, there's the on-site food pantry, a collaboration with a local provider, an arrangement with local food vendors. So the difference between, see, that's a charitable food provider versus local food vendors, that would be a for-profit. We find that most of the applications fall into those three or a combination of those three, but we do include another. You know, we don't pretend to have all the answers. So if you think of another way, hey, you know, propose it to us, and we'd love to see what else, what other options there are out there. We're very flexible in that regard, so long as the core pieces are still met. That's what's most important.
I popped the application link into the chat, so there's another way to grab it as well.
Thank you. Thank you. Okay.
Great questions.
Yeah, great discussion. Do we have any other questions? Just note, we're here and we love to talk about this program. Like, we love to talk about it. This is my, I really, really enjoy this. I've been with this program for about a year and watching it grow, and it's just really amazing to think of the potential. So, you know, we're here and we love to talk about it. So reach out to us anytime. And Monica, I'll see you in a couple of weeks at another offering that we have. So, you know, we'd love to talk to you about it more. So with that, I'm going to go over here and share my screen again. And so with that, we'll let Amy close us out.
Well, I'll just say I appreciate your questions, your attendance. Like Tina said, please feel free to reach out to any of us if you need additional information about the program. We're really excited to see all of the ways that this could evolve. So thank you again, and hope you have a good afternoon.
Thank you, everyone.
Thank you.